Hello, welcome back to another episode of What's Up Doc, Dentist Confessions. Today's story is all about how important it is to prep for surgery. As far as dentistry is concerned, as far as I'm concerned too, as a provider. A lot of the patient that comes through or came through the years had to do surgery, and we get paperwork to fill in to clear them for surgery. Some of the patient feels like it's unnecessary. Some patient feels it's too much work. Some patient will express to us that I'm fine, I don't understand why I need to do this. It's just a simple surgery. So the process of it is basically for us to examine them as thoroughly as we examine every single patient, but also fill paperwork and make sure that there is nothing in the mouth that will risk an infection and will interfere with the surgery healing process. Whether you're having shoulder surgery, whether you're having heart surgery, whether you're having even toe surgery, whether you're having a mole taken out or skin grafting, any surgery that would require for them to sedate you and put you under by an anesthesiologist, they need to make sure that the mouth is very healthy, no teeth are broken, and nothing that's temporarily been repaired or maintained. And the reason behind it is because when they intubate you in surgery, the tube goes down the throat to help you breathe. That's not the critical part. The critical part is when they wake you up. When I did my residency, I have attended so many surgeries, and I have seen how they put people under and how they wake them up. Waking up is the most hectic part of the surgery because they have to pull, the moment they inject you with the antidote to wake you up, they have to pull the tubes so fast, otherwise you'd be choking or you actually will injure your throat. So they pull the tube out so fast and you start gasping for air. And that tube can hit or click a tooth or chip a tooth or hit the roof of your mouth. So they want for us to clear you because they don't want to be reliable for anything that would happen during the process of waking you up for surgery. So what we do is we go around and make sure that all the teeth are intact, all the fillings are intact, nothing needs to be repaired, nothing needs to be upgraded. If some of you is wearing something temporarily like a crown or a filling, that doesn't need to be resolved or upgraded to something more permanent. That's important because think about it, if that tube is coming out really fast and you have a temporary crown, and it happened to me in the past, they will actually knock that temporary crown off, and as a result, and they won't even know it. And as a result, as you are recovering, and some of you, depending on the surgery, we won't be able to see you for about 6 months, you can actually break the tooth that it hasn't been covered. So that's really important to understand. So the story goes, I had a patient years ago, and unfortunately she had passed away already. And she has a bad heart valve, and she needed a new valve. She got a pig valve, which usually back then, I'm not sure if they do it now, that's what they start with when they repair your original valve. They put a pig valve. The problem with the PIG valve, according to her doctor, or according to her surgeon, it has to be replaced every 5 years. And she replaced it once, I think, or twice, and she was due for a mechanical valve, which will last forever. So obviously she came in with her paperwork and her clearance work, and we found a couple of areas that need to be repaired and need to be upgraded. Unfortunately, we ran out of time, and I had put a temporary crown on a lower front tooth, just to temporize it with a permanent cement or permanent glue, because we ran out of time. And I let her know that when she signed the declaration papers before her surgery, to let them know that she had a temporary crown. Because before they intubate you and put you under, you have to sign off, because for liability, that I have a broken molar, I have, a crown, I have a denture, I have a removable denture, which they make you take out, or I have a bridge, or I have an implant, so forth and so on. So she finished all the work with us. I'm not sure if she told them, she remembered to tell them, and I made sure to remind her that please let them know that you have this temporary crown up front, because remember, the tube goes from the front to the back. So when they're going to pull the tube out, they will actually pull it out towards the front. So I was worried about them breaking it, and I said, make sure, I wrote it in her paperwork, and I said, make sure you let them know that it's there. So she gets intubated, she gets into surgery. It was very successful. They replaced the valve. I saw her in 6 months, of course, with pre-medicated antibiotics because of the new valve. So she comes back to the office for her regular checkup and cleaning. But she said, I want to talk to you. Can you see me earlier before my cleaning? And I said, sure. She came in and she looked at me. She was one of the sweetest people I ever met in my life, and she was a really big loss to us. She was so happy-go-lucky. She never fussed. She was so funny, great sense of humor. And so when I saw her and I said, how's everything going? How are you feeling? She goes, I'm feeling fine, but look. And I looked, and the tooth was missing. And I said, oh, did you end up taking that tooth out? She goes, well, they did. And I say, who are they? She says, my heart surgeon. And I said, what do you mean? So what happened was, when they intubated her, the surgeon looked at that temporary crown that I put in, and he saw that the gums were inflamed. So he refused to start the surgery unless that tooth was out. So he pulled her tooth out without her consent before he started his surgery, replaced her valve, and sent her home. And then when she woke up, she noticed that the tooth was missing. And when she asked that question, they said, well, yeah, we had to pull the tooth because it didn't look right, it didn't look good, and we were worried about an infection that will compromise the new valve. She was very disappointed, and she asked him, how could you do this to me? And the surgeon looked at her and said that, well, your tooth or your heart. So live and learn. That was very, very interesting. And I apologized to her. She never ended up replacing it with an implant or anything like that. And she lost the tooth. I was hoping to repair it and save it for her as long as I can. But that's what they do. Of course, every surgeon is different, and every hospital is different. But that was very interesting and something that I never seen before. So prepping for surgery is serious. That's the lesson behind this story. Please let us take our time prepping you, and hope for the best. I hope this helped, and I hope you guys enjoy this video, and thank you for watching. I'll catch you on the next one.